Good afternoon, and thank you very much for listening. And if you have trouble sleeping or sleep next to the snoring partner, I hope this little lecture would be useful for you, especially if you experience pain when you're sleeping. And if you're a medical professional, I would like you to use my channel as a networking ground. And today I want to talk about not such a dental topic, but something what I see every day in my practice. And have you ever wondered why so many of us suffer from back pain, shoulder tightness, and struggle to stand and walk? And what happened to us, comparing to our ancestors who we transitioned from the active styles they had, walking constantly, collecting crop, hunting, to our sedentary lifestyle and convenient transportation. I want to bring some statistic from National Institute of Health, but 30% of us suffer very often from back, neck, and shoulder pain, and 8% become disabled because of that. But I want to tell you, those are not the numbers to me. Those are situations what I see every day in my practice. As a dentist who specializes in dental sleep medicine, I see those struggles so close, and I see people from very young age, I would say 6 months, until a very serious age of 104. And I would like to introduce you to Tom, very typical patient who I see in my practice. And Tom is a man who's suffering from snoring and sleep apnea, but also chronic back pain. He experienced discomfort in every sleeping position. His ex-wife complained about snoring and then she left. He faced seasonal allergies and stuffed nose. Once he stand, his head positioned forward over his shoulder. And for me personally, I have to accommodate it with a specially designed pillow when he lay in my chair to support his neck. But his troubles are not only physical. In addition to physical discomfort, he also suffers from anxiety and depression. And I always wonder with that puzzle why those of us who suffer from sleep apnea also suffer from chronic pain. And that's why I create this talk. And I want to shine a line on this remarkable structure called fascia. And I know I interview several people who specialize in this area. And I want to talk about this organ, what it's a thin casing of connective tissue, what envelop every organ, blood vessel, bone, and a muscle in our body. But it's not a passive structure. It's a very alive structure with a nerve, and it's very sensitive, almost as our skin. It's a silent communicator. What starts the journey on a tongue and goes down from all the organs until the big toe. It's like a seamless web. And it's not only providing internal structure, but it's also communicator. And whenever we experience stress, if it's a physical workout or emotional stress, like unrestorative sleep, strain of the daily life, a lot of inflammation, fascia react. It tighten up. And it's not a sign of weakness, it's a protective mechanism to adapt to changes in the body. Our ancestors, maybe they didn't have a name for this organ, but they pay a lot of attention to that intricate dance between health and harmony. They mention fascia in the Bible 3 times. We're talking about Moses and Zachariah, who was father of John the Baptist. They both were tongue-tied. And Jesus, he loosened up tongue-tie for another man, and it was described in the Matthew Gospels. But over the centuries, midwives, they was always equipped with a nail to sharpen nail to ease the tongue tie for the babies who struggle with breastfeeding. And I'm still confident what you're wondering what it has to do with dentistry. And I want to take you on a journey from the beginning of the life of this newborn baby. If baby were not able to get breastfed, baby would die. And during the breastfeeding, baby have to exercise tongue and lip muscles to get the food out of the breath. It's kind of really strenuous exercise. And after the feeding, baby have to keep the tongue slightly suction to the roof of the mouth. And that's very important position, and it's promote the nose breathing and healthy fascia. But it's impossible to do the same efforts with the bottle. It's so much easier to get milk out of the bottle. And in addition to muscle exercise, breastfeeding also provide very valuable antibodies that protect the baby from infection during first 5 years of life until immune system completely form. And if baby start getting sick, especially with respiratory tract infection, baby open the mouth because nose gets stuffy and tongue stay on the floor of the mouth, and baby breathe with the mouth. But American Indian had that tradition. After the feeding, mom would push the baby jaw up, close the lips with her fingers to stimulate baby to breathe through the nose. And that also stimulate correct tongue position. But point of nose breathing is not something modern pediatricians discuss now. Nose breathing, it's a practice what's so often overlooked in our society. I always ask my patients, how do they breathe? And I would say 70% of them don't know. But another striking fact, 70% of Americans complain on a dry mouth at night. So they breathe through the mouth at night without even knowing that. And now I want to talk about the wonderful era of blenders where we don't have to chew, and it's replaced with the smooth convenience of mashed fruits and vegetables. In ancient time, mom chewed the food starting from when baby was 6 months old. She put that partially chewed food in the baby mouth, and baby have to work hard to chew the food, to exercise, developing those crucial chewing muscles. And from chewing muscles, the jaw grew. But we lost that step in the texture, and we lost that critical step in the jaw development. And the consequences we all know: epidemic of braces in the middle school. And it's kind of normal what every child who goes to the middle school have to get braces. But too many teeth, not enough jaw space, small and retruded jaw, and tongue still the same. And because it's not enough space for the tongue migrates in the airway. And disturbance of breathing trigger fascial response and fascia tighten up. We have 3 important tasks in life: breathing, maintaining balance standing on 2 feet, and keeping our eyes on the horizon level. And fascia play the delicate role of that communication to establish those 3 tasks. And if fascia due to whatever reason tighten in a certain place, then body have to adapt to that balance. And very often, to keep the eyes on a horizon level. And as a result, it's uneven support on the neck, shoulders, spine. And over the time, that imbalance become more serious and manifest itself as a pain on the shoulders, neck, forward head position, and even in herniated disc in the spine. That's a balance or dance between cause and effect. And I want to talk about compensation cascade. And it's very interesting. I really was trying to resolve the puzzle about people grind their teeth. And I think it's a great explanation. I think the body seeks equilibrium in the absence of the support and use the clenching and grinding to include proprioception from the teeth. It's kind of in a counterbalance of the strains imposed by tightened fascia. And dentists always mention stress, like why you grind your teeth? Because you stress. And I look in a little bit different way. I think body try to establish equilibrium, maintain the equilibrium. And in the same time, stand on 2 feet and keep the eyes on the level of the horizon. And all of that, we use the proprioceptions from the teeth. But you can do a simple test to check how is your fascial health. And you see a grinding of the teeth to create that balance. And you can do the simple test. And I recommend you stand next to the wall and see if you can touch the wall in the same time with your head, shoulders, and hip. And your heels can be 2-4 inches in front of the wall. And if it's required, the stretch. And this test provide the knowledge if your body balance or maybe give you some clue to the area what demand attention. And what to do if you experience that discomfort. I highly recommend, and I use it in my practice, I use it collaboration with a specialist, and you see it on my channel, who specialize in postural support. Osteopath, myofunctional craniosacral massage therapist, those specialists, they understand the dance of the fascia, and they can guide your body back to optimal alignment. Of course, very important to check the sleep with the sleep study, to check the level of inflammation in the body, including periodontal infection, and the way you breathe. It also can be very helpful. And just like a lot of my guests recommend, I recommend conscientious breathing, just like Dan Brulot and Dr. Richard Brown recommend to devote 30 minutes a day to the breathing, inhaling and exhaling, laying on your back, keeping 2 hands, one on your chest, another one on your stomach. Make sure air goes all the way to the diaphragm, to the stomach, and you have to use your nose. Inhale on 4, hold the breath on 7, and exhale on 8. This way, you, with the slow inhalation, you involve your parasympathetic nervous system, and that's become a soothing balm for your diaphragm and fascia. And another wonderful habit, holding your tongue on the roof of the mouth. It's not a party trick. That trick, what I talk about that a lot, it's a foundation for fascial balance and overall well-being. And we cannot turn back time, but we can use wisdom, what we learned from our ancestors, and apply them to the modern everyday life. And I wish what your day would be filled with active movement, free from pain, and scented with a wonderful aroma you can feel with your nose, just like it was designed for. And your night be filled with the dreams, nudge free, dry mouth free, and without symphony of snoring. Thank you very much for listening. I hope you can have questions and put them in the comments, and I would be very honored to answer and find necessary information for you. But you have wonderful, happy days and healthy.